Ladies and gentlemen, my fans, my family on YouTube, good morning. How you doing today? We're gonna have a little discussion about UTI today on children. First, what is UTI in definition? UTI is urinary tract infection. It's not really dangerous in children, you know, and then it is normal. If you catch it early, it's not dangerous, it is normal. Especially in young female children, it is common. But in male, I'm not gonna say they don't have it, but it's rarely to have a male have it. So there is a two types of urinary tract infection. You can have the upper urinary tract infection, which we call the kidney or ureters. It is the tube that connect the kidney with the bladder. So we call it upper UTI. Then we have what we call lower UTI. The lower UTI, we call it also urethra. It is the tube that is carry out the urine to your bladder and then outside of your body. Sometimes they call it bladder infection, cystitis. How do the kids get to urinary tract infection? First of all, the vagina of the kid is shorter than ours, which means anything come closer because we have a holes. Anything can go close to the little vagina that the kids have and then travel. First of all, when you have a kid that goes to the child that goes to the bathroom by herself, and then she doesn't know the best way to wipe, she wiped herself from the back to the front. So all the bad thing that is in her behind, she bring it to the front, which can cause her have what we call urinary tract infection. Or the kid love to take a bubble bath, and then all the ingredient that is on that whatever you put in the water for the kids to take the bubble bath so the bubble can pop up can carry a lot of things that is not that the kid is allergy with it, and then they're gonna travel, which gonna give the kids what we call infection. um the sign that you can really know when the kid have infection is like let's say the kids wake up with a fever that coming from out nowhere. The kid is vomiting. The kid is vomiting. The kid is tired. The kid is crying because you have a kid that never cry. And all of a sudden one morning the kid is coming with a fever, crying, tired, and then the kid start vomiting. And then the symptom that the kid will say, "Mommy, my belly is hurting me. My vagina is burning," and you see that kid, she's like scratchy, itchy. She's going to the bathroom frequently. Those are the symptoms. The kids tell you, "Mommy, that happened." You as a mother, if you are a nurse, you would think about urinary tract infection. But if you're not a nurse, you say, "Oh, I don't know what is going on." Even though you are a nurse, even though you are a mother with no medical knowledge, the best thing to do is call the pediatrician of the kid to take the kid to the doctor. So once you go to the doctor, him will run certain tests on the kids, and then they will tell you after that if it's a urinary tract infection or if it's another infection. You cannot diagnose the kid. You have to take the kid to the hospital. So the doctor or the clinic of the doctor, him personally going to run some tests and then tell you, oh, the kid have UTI, urinary tract infection. Well, the doctor will can treat it within 24 to 48 hours because the doctor will prescribe the kids some antibiotics, maybe for 7 days, 14 days, or 21 days. The doctor will give the kids some, it's depend on how serious is the UTI. Once the doctor gave the kids the antibiotics, give the kids all the medications, all the treatments, because some of us have tendency when the doctor gives the medications, after 3 days, after 4 days, if we feel comfortable, the kids say, Mommy, I don't feel like I have to go to the bathroom anymore. I don't have no fever. I am not tired. They stop the medications. Do not do that. Especially with antibiotics, do not stop the medication. Finish all the treatments the doctor give you. It goes for any type of medication that the doctor give you. Because, once you stop the medication, the UTI can come back. And guess what? When the UTI come back, he may be worse than the first one. The kid will end up in the hospital for a couple of days. What do you think is worse? Me, I'd rather be sick than have my kid sick. Because the kid is a kid. You as an adult, you can tolerate anything. But the kid is very small. It is hard for them to suffer. So please, please, give the kid, you as an adult also, when the doctor prescribe you a medication, he said 30 days, take the whole thing. Don't stop it when you feel like you are better. Because when the thing that the doctor tried to treat is not treated properly, it will come back to you. And when it's coming back, it is worse because it's coming back with a new one plus what you had left in you, and then which can take you far away. Okay, how we can teach our children, female children or boy, to prevent UTI, urinary tract infection. First of all, you have to teach your kid on how to wipe themselves when they go to the bathroom. Whether they go do number 1 or number 2, teach them to wipe, always wipe from the front to the back. Always, always wipe from front to back. Never wipe from back to front, because once they learn how to wipe themselves, that is a plus. Number 2, always teach the kid the reason why you don't want them to take a bubble bath. Because if you tell the kid, I am not gonna give you a bubble bath, it is not good for you, you don't give the kid an answer, that's create problem. Tell the kid the reason why I don't want to give you a bubble bath. Because if I give you a bubble bath, you are at risk of urinary tract infection. And then it's not a good sickness. You're going to be tired. You're going to have fever. You're going to have abdominal pain. You're going to miss school. You're going to stay in bed. And then you're not going to tolerate it because your mouth is not going to be good. And then your little vagina gonna scratch, itchy. You have to explain to the kid the reason why. Don't tell the kid, oh, I'm not gonna give you a bubble bath because it's not good for you. Try explain to the kid why I'm not giving it to you. They are kids. There's a lot of things. If you don't explain to them, they'll find out outside. You don't want your kid to learn outside. Let them learn from you, which is wonderful, which is good. And also, the type of panty that you put on your kid, like nylon. Nylon is not a good panty to put on your kid. You can put cotton. And then you can, one more thing, when your kid is born, you can breastfeed that kid for at least a period of 6 months. That boosts the kid immunity. Because we have a lot of kids, they don't have enough immunity. That's why they always sick, 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 because their immune is weak. For the new mothers, please listen to what I'm saying, because you're going to have a baby girl. You have to learn how to deal with all these kind of things. Some mother, they don't like to breastfeed their kids. But when you breastfeed your kid at least 6 months, that's prevent them with a lot of types of sickness that are out there, because their immune is strong. I'm gonna tell you, I didn't do it. My first son, I only breastfeed him for 2 months. My daughter, a month and a half. My first son, I stopped it. I was the one that stopped it. But my daughter, when I went to work after a month and a half, when I came back, she refused it. I forced her, she refused it. But if you can give it to the kid for 6 months, that will prevent a lot of disease, to keep the kid in the hospital. Keep the kid out of the hospital, I mean. And then you can encourage your kid to drink a lot of water, because water is good. That make your the kids urine is very clear, very nice. There is no smell, because most of parents, they like when they give, the kids love juice, 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 or tea, tea, tea. Me, that's happened to me because I have two grandkids. But their mother keep on giving them iced tea. I said, you need to give them water. She give them iced tea, and they love the iced tea. And then the girl especially, she always asking, give me juice, give me juice. And then what she wants is the iced tea, and then the mother give it to her. And I tell her, you need to stop giving her all this juice and then introduce her to some water, because fluid is number one. Water especially will help them to go to the bathroom regularly and then clean their bladder. Do not give them any bubble bath. Do not put nylon panty on them. Do not use soap that smell good to wash them. Use soap that doesn't have no scent. No scent at all. And then make sure you watch the kid all the time going to the bathroom. Wipe from front and to back. Front to back, not back to front. This is what I brought for you today. I wish you enjoyed the video. I wish you like the video, and I wish you subscribe. And then make sure when you subscribe, there is a little bell on top of it that say all. Click on that bell. Once you click on that bell, everything that every video that I post, you'll be able to get a notice. You can watch that video, and then you can like that video. You can subscribe. If there's something that you would like to say, feel free to say it. If you want to comment, if you want to tell me something that I missed, this is not gonna hurt me because, hey, you grow as you learn. You grow as you learn. So that was Mrs. P56 that brought you that little UTI information on your children. And next video, we're gonna talk about something. As I told you, we're not gonna stand on one thing. To my introduction at the beginning, I forgot to tell you that I'm a registered nurse and I'm a respiratory therapist. Right now, I am off work because I had a knee replacement on my right, and I'm going for my second knee replacement. Love the video. Um, abonnez. Abonnez, remen vidéo a, et puis le nou remen vidéo a, nou mette subscribe, essayez gon ti cloche en l'air. Cheke ti cloche la ki di all la. Se li même le mwen mette l'autre vidéo et que nou ap toujou jwen tout bagay. Alors, on connaît nous tout kap tande dans YouTube, kap tande dans Facebook, nous parler anglais et créole. Vidéo a li capable passer pour nous tande li si nous gagnons ti moun, comment pour nous aider ti moun nan pour li pas capable fin gagner ça relé UTI. Eh bien, jodi a c'est ça moi te gen nan jakout moi te pote pour nous comme usually. That's all I have. And I'm gonna say bye-bye. I will see you next time. I love that. Yes, baby. Okay.